What is COVID-19? What will happen to me if I get COVID-19 during pregnancy? What will happen to my baby? And there are so many more questions in the mind of pregnant women regarding COVID-19. Hello everyone. My name is Dr. Ridhima Gupta. I'm American board certified obstetrician and gynecologist. Today, I'm making this video to answer some of the questions regarding COVID-19 and pregnancy, and also I would be sharing my personal experience taking care of pregnant women during this pandemic. What is COVID-19? COVID-19 is a viral illness which mainly affects lungs and breathing. SARS coronavirus 2 is the virus which is responsible for coronavirus 2019 or COVID-19. In March 2020, World Health Organization declared COVID-19 outbreak as a pandemic. Since then, there has been a lot of stress and anxiety in the mind of pregnant women regarding COVID-19. I would be sharing some of my personal experience in today's video regarding COVID-19. The common question asked by pregnant women is that if they are at increased risk of getting COVID-19 infection compared to non-pregnant women. We are learning new data every day about COVID-19 illness. In terms of getting the infection, so far, studies have not shown if pregnant women, just by virtue of being pregnant, is at increased risk of getting COVID-19 infection. Their risk of getting the COVID-19 infection is similar to general population and other non-pregnant women. If they get exposed to the person with COVID-19 illness, certainly they are at risk of getting COVID-19 infection. So the other common question I've been asked is that if I get COVID-19 infection during my pregnancy, what will happen to my pregnancy? Since the emergence of COVID-19 infection, little is known about the effect of COVID-19 on pregnancy. A report published by CDC in June 2020 did mention that pregnant women might be at the higher risk of getting severe disease, and they might be at the higher risk of getting admitted to the hospital and needing ventilator support if they get COVID-19 infection. A more recent study published from 2 New York hospitals saw that the risk of getting severe disease in pregnant women is actually similar to the non-pregnant women. So based upon these limited studies, we really don't know what is the effect of COVID-19 on pregnancy. Does the pregnant woman get higher risk of getting severe disease or not? We don't know. There are certain risk factors which are associated with more severe disease in the pregnant mothers, and these include advanced maternal age, which is more than 35 years, or if they are obese, or if they have pre-existing diabetes or hypertension. During this pandemic, I also had a chance to take care of several pregnant mothers who got COVID-19 infection. The good news is that these pregnant mothers did really well. They were young, healthy overall, low-risk pregnant women, which means that they did not have other medical comorbidities, and they got exposed to COVID-19 infection during a social gathering or during their trip to the grocery store or at their workplace. They did develop mild symptoms, but none of them needed hospitalization. And after they did 15 days of quarantine, and they were able to resume their work-life balance without any problems. Since we do not know much about the effect of COVID-19 on pregnancy, and there is also the data that pregnant women can get potentially very sick, I would recommend to all pregnant women to take all the precautions and avoid getting exposed to COVID-19. Avoid going to social gatherings. If you really have to go to the social gathering, always wear your face mask. Maintain a 6 feet distance from the other people. Also, use your hand sanitizer or wash your hands with soap and water for 20 seconds. You can always order the groceries online or over the phone, and then you can go through drive-through and pick up your groceries. In that way, you can avoid going to the grocery stores. During this time, it is also very important for the pregnant mothers to keep all their doctor's appointments. And the flu season is coming up. It is important that you should get your flu shot and your tetanus shot. If you're having any anxiety, stress, depression, or any concerns regarding COVID 19 and pregnancy, please talk to your doctor. Please seek out help and stay safe. The common symptoms which the pregnant mom presented with were fever, headache, cough, sore throat, congestion, muscle pain, and loss of taste. When these patients presented with these symptoms, the testing for COVID 19, which is a PCR test on the nasal swab, was performed. After the mother was diagnosed with COVID 19 infection, I did inform them to self isolate themselves for 15 days. During this time, I recommended that they should continue their daily routine, take their prenatal vitamins, take lots of rest, drink plenty of fluids, and keep good hydration. For the symptoms of fever and headache, they can take Tylenol. If they have congestion, they can certainly use steam inhalation and nasal saline drops. If the patient is in third trimester, we did inform them to keep a very close eye on the baby's movement and watch out for any labor signs. If they develop any decreased fetal movement or labor signs like contractions, vaginal bleeding, or leakage of fluid, they should report to the nearest hospital. We also did inform them that if there is any symptoms like shortness of breath or chest pain or any worsening in their breathing status, that they should immediately report to the hospital or the nearest emergency room. During this pandemic, I also had a chance to take care of pregnant women at the hospital when they presented with the signs of labor. I have performed vaginal deliveries and cesarean section on the patients who had COVID 19 infection. In my personal experience, they have done really well. The procedures were uncomplicated. COVID 19 infection in itself is not an indication for cesarean section. The patient I performed cesarean section on, she had previous cesarean section and there was an obstetrical indication of performing the C-section. COVID 19 does not decide the route of the delivery unless patient is really sick and delivering her via C-section is important for her disease course. So after the baby is born, we have tested most of the newborns for COVID 19 infection if they're born to the mother who had COVID infection. In my personal experience, none of my patients' babies were positive for COVID 19 infection. It is not known if the baby born to the mother with COVID 19 infection is at higher risk of getting the COVID 19 infection. There are some reports which did mention that baby was positive, but we don't know if the baby got the infection during pregnancy or during childbirth or after the baby was born. Most of my patients did decide to stay in the same room as the baby. We did told them at that point to try to maintain a 6 feet distance from the baby, and when they handle the baby to definitely wash their hand with soap and water. Always wear a face mask when handling the baby. And most of my patients did really well. Breast milk is very healthy for the baby. Breast milk protects the baby from many illnesses. There are very few contraindications to breastfeeding. It is also not known if the COVID virus is transmitted through breast milk or not. After the baby was born to the COVID positive moms, we did discuss with them if they desire to breastfeed or not. Most of the moms did decide to breastfeed. After they decide to breastfeed, we did told them that they should always wash their nipples and hands before they initiate breastfeeding. They should always wear the face mask. Try to keep their face a little away from the baby if possible. And also, they should be cleaning the surfaces with disinfectant. We also discussed with the moms if they decide to give the express breast milk. If they did decide to give the express breast milk, we told them to again wash their hands and nipples with soap and water, express the milk in the bottle, and then maybe a healthy relative can feed the baby. After the mom got discharged from the hospital, we kept a very close eye on these moms. We periodically check on them. We did call them to make sure that they are not having any sign and symptoms of depression. We performed a comprehensive postpartum visit at 6 weeks mark to ensure the well-being of mother and the baby. The other common question I've been very often asked is that if this is a good time in my life to get pregnant. And the answer to that is that this is a very individual decision. If this is something which can wait few months or an year, then yes, you can wait. If this is an ideal time in your life to get pregnant, or if you are advanced maternal age, which is more than 35 years of age, and you know that there can be certain other conditions which can be a little difficult in your life to get pregnant, then I would strongly recommend that you can consider getting pregnant at this time. You can also go and talk to your doctor and they can assess your risk factors, your medical conditions, your age, and certainly they can take different factors into consideration and then they can recommend that if you can wait or if you should consider getting pregnant at this time. If you like the video today, please subscribe to my channel. Please like the video and hit the bell icon. If you have any questions for me, please leave in the comment section. I would like to hear from you guys. Thank you so much for watching. Have a good day.